Welcome to the deep dive. We're diving into the freshest healthcare news today, giving you all the need-to-know info.
Yeah, we've sifted through tons of articles and reports, and let me tell you, there's a lot
For
happening.
sure. Definitely a lot to unpack.
From AI and your discovery to telehealth and even some politics, we're going to cover it all and give you the most interesting takeaways.
Sounds good? Ready to jump in?
Let's do it,
Let's start with telehealth.
okay?
It seems like it's here to stay, but patients are really pushing for a better experience.
Definitely. One thing that really needs to be improved is communication. Imagine trying to explain something complex about your health over a video call that keeps cutting out.
Oh yeah, I can see how that would be frustrating.
Patients need clear explanations and a chance to ask questions. They need that reassurance that they're being heard, even if it's through a screen.
Makes sense. It's about building that same trust you'd have in person.
Exactly. And, another trend we're seeing is AI popping up everywhere in healthcare.
AI.
Yeah, like diagnosing infections or even streamlining communication with providers.
I actually heard about AI being used to detect sepsis early on.
Oh, yeah.
Yeah, sepsis is a serious condition and it can be really hard to diagnose.
Right.
So using AI could actually save lives.
That's a great example, but AI has its downsides too, particularly when it comes to cybersecurity.
Oh, right. Cybersecurity.
Hospitals have so much sensitive data, right?
Yeah.
Well, hackers are using AI to develop more sophisticated attacks, making it tougher for hospitals to protect all that patient information.
So it's a trade-off.
Yeah, kind of like a constant back and forth between innovation and security.
We need AI to improve healthcare, but we also have to make sure that patient data is protected.
Absolutely. Okay, let's switch gears for a second and talk about politics and policy.
Always a fun topic.
Well, House Republicans are proposing some significant cuts to Medicaid in their budget plan.
Medicaid.
Yeah.
Medicaid is so important for millions of Americans, especially for children and low-income families. Those cuts could really limit access to essential healthcare services.
And on a similar note, there's a new commission being formed to look at threats to children's health.
Really?
Yeah. One of their main focuses is the possibility of over-medication in kids.
That's interesting.
Then this commission could actually influence how doctors prescribe medications and raise awareness about being careful with medication management.
So we have potential cuts to healthcare on one hand, and then a push for more cautious medication practices on the other?
It's definitely complicated and could have some far-reaching consequences.
For sure. And to add to the complexity, some states are actually backtracking on work requirements for Medicaid recipients.
Oh, really?
Yeah, those requirements that the Trump administration put in place.
Right.
They've been facing quite a bit of criticism and even some legal challenges.
It's interesting to see how politics directly impacts healthcare policy and people's access to care.
Definitely. Now let's talk about some good news for a change. What about those advancements in drug delivery?
Oh yeah, researchers are working on new ways to treat glaucoma with just a single injection under the eyelid.
Wow. So no more daily eye drops.
Potentially. Think about how much easier that would be for patients.
Oh, absolutely. No more struggling with eye drops every day.
Exactly. And that's not all. AI is also speeding up drug discovery for other conditions.
AI again.
Yep, it's everywhere. For example, there's a company called Gain Therapeutics using AI to target protein misfolding disorders.
I think I read about them. They're developing drugs to correct those misfolded proteins, which are involved in all sorts of diseases, right?
Yes, from Alzheimer's to cystic fibrosis. It's pretty amazing.
That's really cool. It sounds like AI is revolutionizing how we approach treatment for these really complex conditions.
It really is. Now, on a more serious note, let's talk about the flu.
Okay.
Flu deaths have actually surpassed COVID-19 deaths for the first time since the pandemic started.
Wow, that's concerning.
It is. The CDC is working on these outbreaks, but they're running into a major problem.
What's that?
Missing data. There are delays in getting critical information, which is slowing down their ability to track and respond to these outbreaks.
So even with all our technology, data gaps are still a big challenge.
Unfortunately, yeah. Now, let's talk about the business side of healthcare for a bit. Hospitals are facing more and more financial pressure.
In what way?
Labor and drug expenses are going up.
I can imagine. And with 26 million cancer survivors projected in the future, that puts an even bigger strain on resources.
It's a lot to manage, and hospitals are trying to adapt. One strategy is investing in data platforms to make patient care more efficient.
Makes sense.
They're also teaming up with tech companies to boost their cloud-managed services for better efficiency.
So they're having to find creative solutions to provide care in a sustainable way.
Exactly.
It's definitely a complex situation with a lot of moving parts.
It is, and we've only just scratched the surface. We are talking about the financial pressure on hospitals.
Yeah, it's a tough situation for them. One hospital system, UPMC, is actually closing a maternity unit because of these pressures.
Wow, really?
Yeah, they're moving the services to a bigger hospital about 35 miles away.
That's a pretty big distance for expectant mothers to travel for care.
Exactly. It shows how these financial challenges have real-world consequences.
For sure. And let's not forget about the rise of drugs. That's a huge factor, too.
Absolutely. It seems like pharmaceutical companies are relying more and more on pharmacy benefit managers, or PBMs, to handle drug prices.
PBM?
Yeah, those middlemen in the pharmaceutical
Oh,
world.
right, PBMs.
They've been pretty controversial. Can you explain what they do?
Sure, they're basically the gatekeepers. They decide which drugs are covered by insurance and how much patients pay.
Okay, so they have a lot of power.
Yeah, some people argue they help lower drug costs through negotiation, but others say they actually drive prices up by demanding rebates from drug companies.
It sounds like a complicated system.
It is, and then there's the rise of biosimilars, which are like generic versions of those expensive biologic drugs.
Biosimilars. I've heard of those. Are they as effective as the original drugs?
They're supposed to be very similar, but they have to go through rigorous testing and regulatory oversight to make sure they're safe and effective.
So the FDA has to approve them.
Exactly. Speaking of the government, there have been some big job cuts at the Department of Health and Human Services.
Really?
Over 5,000 probationary employees were let go.
That's a lot of people. Why the cuts?
To save money and streamline the agency, but some critics are worried that it could actually weaken the agency's ability to protect public health.
I can see how that could be a concern.
And in other news, the Trump administration just appointed Robert F. Kennedy Jr. as the new HHS secretary.
Robert F. Kennedy Jr., wow. That's a pretty big appointment.
It definitely sparked some strong reactions. Some people are excited about his work on children's health, while others are concerned about his views on vaccines.
I remember he's going to lead that new commission on children's health we talked about earlier.
That's right, the one focused on potential over-medication in kids.
It'll be interesting to see what kind of impact he has on that commission.
Definitely. Now let's go back to AI for a minute. We talked about its role in drug discovery, but it's also making big changes in cybersecurity.
Cybersecurity. Right, because hospitals are prime targets for hackers.
Exactly. They're using AI to strengthen their defenses and respond to threats more quickly.
So AI is a tool for both sides.
Unfortunately, yeah, hackers are using it too to develop even more sophisticated attacks. It's like a constant arms race in the digital world.
So what can hospitals do?
They need to stay vigilant and invest in strong cybersecurity measures to stay ahead of the curve.
Makes sense. But besides cybersecurity, what about AI's role in directly improving patient care?
Well, one exciting area is personalized medicine. Imagine treatments tailored to your specific genes and lifestyle.
That sounds pretty futuristic.
It's becoming a reality thanks to AI. It's also helping doctors diagnose conditions more accurately, which can lead to earlier and more effective interventions.
So AI is transforming healthcare on multiple levels.
It really is, and it's not just about the technology itself, but about using it to enhance the human side of healthcare.
What do you mean by that?
For example, AI-powered tools could free up doctors from paperwork so they can spend more time connecting with their patients.
That would be amazing. It would let them focus on building relationship and providing compassionate care.
Exactly, and that brings up an important point. With all this talk about technology and policy, we can't forget about the human aspect of healthcare.
Right. Patients are more than just data points or medical cases. They're individuals with unique needs and experiences.
That's where the concept of humanism in healthcare comes in. It's about recognizing the dignity and worth of every patient and treating them with compassion, empathy, and respect.
And listening to their concerns.
Absolutely. Unfortunately, in the fast-paced world of medicine, that human connection can sometimes get lost.
I can see that. That's why organizations like the Gold Humanism Honor Society are so important.
They promote humanism in healthcare and recognize medical professionals who go above and beyond to provide compassionate care.
It's a good reminder that even with all the advancements and debates, the human connection is still at the heart of healthcare.
Couldn't agree more.
We've talked about all these challenges and advancements in healthcare, but what about the patients themselves?
Right, it's not all about hospitals and technology.
Exactly. Patients are a huge part of this whole system.
They really are, and the healthcare landscape is shifting. Patients are becoming way more informed and engaged.
Definitely. They're not just sitting back and accepting whatever care they're given anymore.
Nope, they're taking charge of their health.
Like we saw with telehealth, patients are demanding a better experience. They want clear communication and to feel like their concerns are heard.
It's a good sign they're speaking up and pushing for change.
And it's not just telehealth either. More and more patients are demanding access to their own medical data.
Makes sense, right? In today's world, everyone wants access to information.
For sure. People want to see their records, understand their diagnoses and treatment options, and be a part of the decision-making process.
It's empowering. When patients are informed, they can make better choices about their health.
And it turns that old paternalistic model of care on its head.
Totally, it's becoming much more collaborative.
Patients and providers working together as a team.
Exactly, and that collaborative spirit is extending beyond the doctor's office. We're seeing more collaboration between researchers, clinicians, policymakers, and of course, patients.
It's like everyone's realizing that we're all in this together.
We have to break down those walls and work together to build a healthcare system that truly puts patients first.
And that brings us back to humanism in healthcare.
Right. In the midst of all the technology and policy, we can't forget about the human side of things.
Treating patients with compassion, empathy, and respect.
Exactly. But it's also about remembering that each patient is an individual.
With their own unique story and experiences.
Right. It's about understanding their needs, listening to their concerns, and providing care that's tailored to them.
That's where the real power of human connection comes in.
It's about seeing the whole person, not just their symptoms.
And empowering them to take control of their own health.
So they can navigate the system with confidence and support.
And ultimately have a healthcare experience that's both effective and compassionate.
Well said. That's a great note to end on.
As we wrap up this deep dive, we want to encourage everyone listening to think about their own role in this changing healthcare landscape.
Whether you're a patient, a provider, or just someone who cares about healthcare, your voice matters.
Stay informed, stay engaged, and speak up for a system that puts patients first.
That's what it's all about.
That's it for the deep dive today. Thanks for joining us.
Stay curious and stay well, everyone.